My name is Sue-Ann Mankin, and I came to Envita because I had breast cancer. Upon finding out that I had breast cancer, I just felt led really by God to do a different type of treatment, to go a different pathway than traditional treatment. I did have surgery. I did have to have a mastectomy. So they were recommending radiation and chemotherapy for me, and I just didn't feel like it was the right thing for me. I just had the sense that if I did the standard form of treatment, that I could have severe long-term side effects from it. The good news about radiation chemotherapy is that it kills your cancer, but the bad news is that it seems to destroy your immune system. My whole goal from having breast cancer was not just to get rid of my cancer. That was never my goal. My goal was to have healing inside my body. First oncologist that I talked to, I spent probably 2.5 hours in his office, and after about 2 hours, it was like this light bulb went off in my head, and I said to him, I said, "You can't heal me, can you?" I remember that every time I would talk to an oncologist in traditional medicine when I was trying to get information, I realized they never used the word healing. He said to me, Sue-Ann, he said, "We doctors hate patients like you. You know too much information and you ask way too many questions." I knew he was telling me to read between the lines and to stay on the path that I was on. And so I really felt like, you know, when you ask God to give you answers, if you're willing to listen and search for them, He'll give them to you. When I found out about Envita, I came here, liked what they had to say, and just felt like that it could help me. And they told me that they would basically, do things to strengthen my immune system and oxygenate my blood. I know that cancer cannot live in an oxygenated environment. It thrives in an unoxygenated environment, and that the healthier you are, two things: A, the stronger your immune system is, and B, the more oxygen you have in your blood. And I knew that traditional treatments would do the exact opposite of that. So that was why I really felt very strongly from the get-go when I got here that this was the right treatment for me, that this was the way God was calling me to go. It's not just some treatment that they thought up. It's backed by research and years of medicine in other places and just stuff that works. Each time then you come in after you've had a series of treatments, and you come in and you put it back on the big screen TV and you can actually look at your cells and the way they were, and then you look at them now and you can see the progress you're making, and so to me that's so exciting. I mean, you know that they are helping you to heal. It's interesting, though, because here I am now, almost 2 years later, and I go still every 4 months to see my traditional doctor, my surgeon. She has told me how wonderful everything looks and to just keep doing what I'm doing. So I know that it's those little monumental victories, so to speak, that makes me know that it is worth it so many times to step out of doing the norm or what is protocol, and to do something that heals your body and that you're led by God to do. I mean, to me, it's just so much more worth it. I guess that's why when people ask me about Envita, I encourage them so much. I know it's a step out from the norm, but it is so worth it. So worth it. Hello, I'm Sue-Ann Mankin, and this is my story. What is yours?